Today we will discuss the fibrinolytic drug or thrombolytic drug. First we study the mechanism of action of this drug. This thrombolytic drug first stimulate the plasminogen and convert the plasminogen to plasmin, and this plasmin convert the insoluble fibrin to soluble fibrin. Insoluble fibrin is a very important component of the clot, and when insoluble fibrin converts into the soluble fibrin, the clot gets dissolved, and in this way they act as a thrombolytic drug or the fibrinolytic drug. Okay, most of the drug directly convert plasminogen to plasmin. However, there is another drug which is streptokinase. It combines with the plasminogen. It does not, by combining with the plasminogen, it does not directly convert plasminogen to plasmin. Rather, it converts plasminogen first into the plasminogen activator, unlike other drugs which directly converts to plasmin. It initially converts into the plasminogen activator, okay, and then this activator converts plasminogen to plasmin, and then this plasmin convert insoluble fibrin to soluble fibrin. This streptokinase act indirectly as compared to the other fibrinolytic drug. This point you have to remember. Okay, then we study the drugs. Drugs are divided into two groups. One is locally acting or the fibrin specific, and another group having the local as well as systemic action on the thrombus. First understand what is local action and what is local as well as systemic action. The plasminogen is present either on the fibrin which is present on the thrombus, or plasminogen could be present freely in the circulation. Suppose this is the circulatory system, and this is the thrombus, and in the thrombus there are present fibrin. Okay, these are fibrin strand, and in the fibrin strand plasminogen is present, and plasminogen is already freely floating in the circulation as well. And these local drugs act where the plasminogen which is present on this fibrin. These are the local drug. These are the fibrin specific drug or the locally acting drug. They stimulate the plasminogen which is present on the fibrin, present on the clot. And those drugs which are having the local plus systemic action, they not only stimulate the plasminogen which is present on the fibrin, but also stimulate the plasminogen which is freely floating in the circulation. This is the systemic action. And the drug which are having the fibrin specific drugs are ratipase, alteplase and tenecteplase. You can remember it by mnemonic RAT. Okay, and the drugs having local as well as systemic action, the drugs are urokinase, streptokinase and anistreptase. You can remember it by mnemonic USA. Okay, now the fibrin specific drugs are non-antigenic, so there is no risk of allergic reaction with these group of drugs, and these are more efficacious as compared to the USA group of drugs. However, the incidence of hemorrhage is almost similar with both the groups. Okay, and except alteplase which is short acting, the ratipase and tenecteplase are long acting, so they have to be given as a single bolus infusion. This is alteplase is short acting. Okay, this point you have to remember. Then the urokinase, except urokinase, streptokinase and anistreptase are antigenic. Urokinase is non-antigenic. Okay, and urokinase is obtained from the urine, and it is used in where catheter related lysis of the thrombus is required in the deep veins as well as in the peripheral arteries. Okay, the streptokinase is obtained from the beta hemolytic streptococci, and it is more antigenic as compared to other group of drugs, and when it repeatedly given, the neutralizing antibodies are formed against this group of drug, and because of repeating dosing it becomes less efficacious. Okay, however it is very less expensive, and that's why it is most commonly used as compared to the other fibrinolytic drugs. Okay, and anistreptase is obtained by combining streptokinase with Lis plasminogen. Okay, and because of which it becomes long acting, and it has a half-life of about 100 minutes, and it is an antigenic, already told you, and because of its long action it is given as a single bolus infusion. Now the uses of fibrinolytic drugs, it is used in acute MI. Okay, in the acute MI it should be used within 12 hours to have a very good effect on the thrombus. Okay, and it is also used in condition with severe pulmonary embolism. Okay, and now there are certain absolute contraindication for the use of fibrinolytic drugs. It should not be used in patients with marked hypertension, and in patients with active internal bleeding, and in condition or in suspicion of aortic dissection in a patient, and in patient with stroke. If it is hemorrhagic stroke, it should at any time it should not be used. However, if it is non-hemorrhagic stroke occurring within 1 year, it should not be used. After 1 year, we can use it in cases of non-hemorrhagic stroke. You can remember the contraindication, absolute contraindication of fibrinolytic by mnemonic mass. M for mild hypertension, A for active internal bleed, S for suspicious of aortic dissection, and another S for stroke. Okay, now we take the antidotes of the overdose. When there is overdose of fibrinolytic drugs, there is excessive bleeding. For that we use the antidotes, and these are tranexamic acid and epsilon amino caproic acid. Okay, now we take few points about plasma expanders. Plasma expanders are basically the high molecular weight substances, and that's why it exerts the osmotic effect on the circulation and retain the fluid within the circulations, and that's why they are mostly used to correct the hypovolemia as occur because of the blood loss in trauma patients. Okay, the plasma expanders, we have the albumin, dextran, polygylene. Plasma expanders are albumin, dextran, polygylene, and heat stroke. Okay, albumin and polygylene, they do not interfere with the blood grouping and cross matching, also with the coagulation process, and also with the platelet function, while the dextran and heat stroke interfere with the blood grouping and cross matching, and with the coagulation system, and with the platelet function. Okay, the most commonly used out of these is the dextran, and the dextran is of two types, dextran 40 and dextran 70. The dextran 40 expand the plasma for less than 24 hours, while dextran 70 expand the plasma for 24 hours, whereas polygylene expands the plasma for 12 hours and heat stroke expand the plasma for more than 24 hours. Okay, and the dextran has an advantage of decreasing the viscosity of the blood, and it also reduces the Rolex formation and thus improves the microcirculation. While there are certain contraindications for the use of the plasma expander, it should not be used in patients with severe anemia, and in patients with major organ failure like liver failure, kidney failure, heart failure, and patients with pulmonary edema. Okay, now few MCQ regarding today's topic. Okay, altiplase differs from streptokinase as it is longer acting, derived from the human kidney, cheap, activates the plasminogen bound to the fibrin. As I already told you, altiplase is shorter acting, not longer acting. Retiplase and tenecteplase are longer acting. Altiplase is short acting, and it differs from this streptokinase because it has the local and it is more fibrin specific, and because it is fibrin specific, so it activates the plasminogen which is bound to the fibrin. This is the right option. Okay, plasma expanders are used in severe anemia. No, it is contraindicated in severe anemia. Severe trauma, maybe. In pulmonary edema, no, it is contraindicated in pulmonary edema. It is contraindicated in cardiac failure, and it is also contraindicated in severe anemia. So it is used in severe trauma when there is severe blood loss. Okay, this is the right option. Then absolute contraindication to the thrombolytic therapy. The options are pregnancy, history of hemorrhage stroke in past 1 year, patient on nitrates, and patient with hypertension. The answer here is history of hemorrhagic stroke in the past 1 year. Hemorrhagic stroke at any time is a contraindication for thrombolytic therapy. Okay. However, if it is non-hemorrhagic stroke in the 1 year, we can use it. We cannot use it. Okay, after 1 year in cases of non-hemorrhagic stroke we can use it, but hemorrhagic stroke at any time is a contraindication. Pregnancy is a relative contraindication. Hypertension is marked hypertension is an absolute contraindication, not the hypertension. Okay, that's it. Thank you. Keep smiling. If you like my video, please subscribe my channel and hit the bell icon.